focusing on the issue of health care. For those in Washington who say, go slow, start over, don't do anything big, go small, I would like to tell them a simple fact of life. From 2000 to the year 2008, insurance companies raised their average family premiums 3 times faster than wages. Some of those premium increases are 5 to 10 times larger than the rate of growth in national health expenditures. The profits for the 10 largest insurance companies across America increased 250% between 2000 and 2009. So for those who say go slow, I can tell them this. The health insurance companies of America aren't going slow when it comes to raising premiums.
We started a retail store 17 years ago in the neighborhood we lived in. And so when we started getting insurance through the business, all of our full-time employees started to get insurance through our business. That has become more and more difficult as the years have gone by. It used to seem like it was just the right thing to do until the premiums started to get so high that we couldn't afford the same kind of coverage. So our broker said, well, you know, change the deductible. Okay, well that's one thing, but what does that mean to the employer, what does that mean to the employee who then has to pay for that extra deductible? That's out of pocket expense. Can I afford to maintain insurance and give them a raise? That became the issue. Then, as the premiums went up further, well, you know, why don't you change the copay? So there's another $10 every time they have to go to the doctor, or another $10 every time they have to get a prescription. But we want to do the right thing. So we keep cutting back on deductibles, cutting back on the kind of coverage they get. They keep having to pay more if they go to the doctor. Then you start making decisions. Do I really need to go? Do I really need that prescription? This is not the kind of thing that seems fair, that seems caring, that is showing that we consider the well-being of our employees.
We opened about 3 months ago, as of this past Friday. We started off with 3 full-time employees and started to add on extra staff. One of the first things we needed to look for was, healthcare for my employees and for myself. Trying to find a coverage for 3 people is kind of difficult, needlessly difficult, I find, in a lot of respect. We went through different brokers, talked to different people, tried to get the best type of coverage. Our original quote came back to us with, which looked excessive, but something we could definitely afford. When the final rate came back, it was 60% increase above what our original quote was. That was just not sustainable. I don't understand why, as a small business, we're saddled with the notion of trying to find affordable health care that is constantly changing in pricing. That's hard for us to really to be competitive in a world market. I'm actually scared of next year because while we may have gotten the coverage this year, you see these rates coming up pretty high within your 2nd to 3rd year. I don't know how much I can actually cover for our employees as we move forward.